Hey YouTube, it's Mac8208, and I wanted to tell everyone a little bit about myself, for those of you who don't know that much about me. Well, I was born with Becker's Muscular Dystrophy, and I've been in a wheelchair for 12 years of my life. But for those people that don't know what muscular dystrophy is, or what Becker's muscular dystrophy is, it's it is an inherent disorder that evolves slowly, worsening muscle weakness of the legs and pelvis. And the symptoms usually appear in men about age 12, but may sometimes begin later. Like with me, it began later when I was 14 years old. That's when I started getting some of the symptoms of what you call muscular dystrophy. But I'll tell you, if you don't know what the symptoms are, cognitive problems, that kind of thing. I got fatigue, that's another problem. Loss of balance and coordination, that's a big issue too. Muscle weakness in arms, neck, and other areas. It's not as severe as in the lower body though. And it's just like there's frequent falling, like if you're a person that walks with Becker. And then there's the average age of being unable to walk is between the ages of 25 to 30. And of course you have difficulty with muscle skills, like running, hopping, jumping, all that sort of thing. And then of course loss of muscle mass and of course respiratory problems. That's some of the things that Becker muscular dystrophy does to people. And then, when people ask, is there a treatment or a cure or anything for it? But there is no known cure for Becker's muscular dystrophy. There's treatment that tries to control symptoms to maximize quality of life, And some doctors have prescribed people with steroids to help to keep the patient walking for as long as possible. And they gave me steroids when I was younger. That's why I kind of ballooned out a little bit. But they always tell you though, with anything, activity is encouraged. Inactivity such as bed rest can worsen, the muscular disease. Physical therapy may be helpful to maintain muscle strength. And orthopedic appliances such as braces and wheelchairs may improve mobility and self-care. And yeah, I am in a wheelchair. I use an electric wheelchair. That's how I get around, Call it my magic legs. Alright? And they also say that genetic counseling may be advisable. Sons of a man with muscular dystrophy do not develop the disorder, but daughters may be carriers. The daughter's sons may develop the disorder. So that's pretty much what Becker muscular dystrophy is. And I pretty much have it, like I said. And also, the thing about Becker's muscular dystrophy is that it's very similar to Duchenne's muscular dystrophy. Except that it gets worse at a much slower rate. So I've been in the same situation for quite a few years. I haven't really worsened or got any better or anything. I'm just, at a standstill right now with it. And they said that the disorder is inherited, Women really develop symptoms. But men can develop the symptoms if they inherit the definitive gene. And to tell you the truth, this is some statistics right here that I got for you. Becker's muscular dystrophy occurs in approximately 3 out of 6 of every 1,000 males. That's quite a bit, folks. That is a bit. Because this is an inherited disease or a disorder that includes having a family history of Becker's muscular dystrophy. And I do have a family history of that because one of my great-grandmothers had Becker's muscular dystrophy. So that's how I got it and that's how it went down. But anyway, my name is Mac, 8208, and I just wanted to let everyone know about Becker's muscular dystrophy. Thank you.